UNC at Chapel Hill hosted the Carolina Mental Health Update Summit to recap current efforts towards campus mental health and well-being. Mental health is one of the most critical issues today in higher education. The most recent Stress in America survey suggests that young adults across the nation are currently experiencing high levels of stress and distress. 91% of the 18 to 21 years old report they have experienced at least one physical or emotional symptom because of stress. Susan Roos is a parent of class of 2025 student and a parent council member. After the tragic events of 4 students who died by suicide on UNC campus, she says parents serve as an important partner around these critical issues of students' mental wellness.
There's a stigma with mental health. Let's be clear about that. I think COVID has maybe brought mental health to light so that people are able to talk about it more, so much more than, God, when I went to college, nobody ever talked about any of that stuff. So I think the more we can bring it to light, the easier it is for our students and children to be able to talk about it and reach out for help. But obviously, the bigger the issue that happens, suicide, the more aware the campus is. But the smaller the issues, which can build, that's what's important, is to be able to recognize those smaller issues. And I was only aware of CAPS, and I know that it's a subjective reaction to, everyone has subjective feelings about that.
CAPS is a shorthand for the university's counseling and psychological services. It is the main mental health resource for students. But after the campus suicides, students struggle to get available appointments. Avery Cook is the clinical coordinator at CAPS. She says CAPS is working on the immediacy of care.
We want to make sure that students who need to connect with mental health services are able to do so really at any time. This starts with our CAPS 24/7 approach, where a student is able to call the main CAPS number at any time, day or night, and speak with a therapist in that moment.
Cook says data shows that poor student mental health is a national issue and requires nationwide attention, but changes start at the university's level. UNC is the oldest public university and should provide examples for others to follow. This is Charlotte Zhao reporting from Chapel Hill.